The explosion in the number of cosmetic surgery procedures performed in the U.S. has created a new demand, revision of unsatisfactory results, either because of unrealistic expectations or due to errors by the doctor. Joining me to discuss the options for patients who are looking for a fix is Dr. Peter Fedor, a board-certified plastic surgeon and past president of the American Society for Aesthetic Plastic Surgery. Dr. Fedor is also the medical editor of Be Your Best, a comprehensive guide to aesthetic plastic surgery written by the experts. Welcome, Dr. Fedor. Thanks so much for being here.
Thank you very much. Good morning, Meg.
Good morning to you. And so you say that redoing plastic surgery procedures now accounts for half of your practice. That's an alarming number. Why do you think you're seeing so many problems?
Well, it doesn't mean that 50% of all procedures have to be redone. It's just that some of us have gained a reputation for having an ability to improve on results that were somewhat unsatisfactory from the previous surgery. But in general, according to the statistics of the American Society for Plastic Surgery, the plastic surgical procedures that have been performed, it has increased every year. Unfortunately, not all procedures are performed by properly trained and board-certified plastic surgeons. So between those two, an increased number and the question of the ability of the provider to start with has led to a lot of redo surgery.
Right, and you say fixing a cosmetic procedure is much more complicated than performing the primary procedure. Why is that?
Well, a number of reasons. First of all, there are scars on the outside, and that's like a roadmap that to a degree you have to follow when you're doing the redo surgery. But what's not as well understood is also scarring inside. There's also surface irregularities, for example, in liposuction, irregularities, asymmetries, divots, and so those things are much more difficult than doing it first time around. When it comes to rhinoplasties, it's a very common procedure, and problems can come more times than not from overdoing the nose, for removing too much. I think a nose has to be kept in balance, and the appearance after surgery has to be very harmonious with the rest of the face. So a nose that is scooped out too much or the tip is turned up makes the redo surgery a lot more complicated. Oftentimes, when it comes to rhinoplasties, or the medical word for nose jobs, the structures are missing and they have to be replaced in order to rebuild the nose to a pleasant appearing nose. And at times we have to borrow cartilage either from the inside of the nose if there's sufficient amount left, or we have to go to the ears or to bone or to ribs even.
Now, another common surgery that often needs to be fixed is the face and neck lift, and what's behind that?
Well, that depends on the direction of the pool. If the pool is excessive and imparts a wind tunnel sort of appearance to the face, or if the pool is too much going from front to back as opposed to upward, because when we age, the sagging with the gravity comes in a downward direction. So the best way to take care of that is lift it back to where the structures are supposed to be.
So, Dr. Fedor, let's talk about what a patient can do to avoid revision work. And the first thing you suggest is that patients should do their homework when picking a surgeon, correct?
Well, first time around they need to do their homework, but even more so when they're having a redo or secondary surgery. That's a very important thing to do, and does not hurt to interview more than one surgeon, perhaps to ascertain that the surgeon is a member of the American Society of Plastic Surgery, American Society for Aesthetic Plastic Surgery, and in general a board-certified plastic surgeon with proper background and training.
Okay, and you also need to be very honest with your redo surgeon in terms of past medical surgeries and medicines that you're taking. And how often are patients not that honest?
Unfortunately, at times patients are concerned that they will not be accepted for surgery, and they neglect to mention some of the surgeries they had or some of the general medical problems they had. In my particular practice, all patients undergoing primary or secondary surgery have a very comprehensive medical evaluation, in order to make sure that they are in good health and that surgery can safely be performed.
And how quickly can you have this surgery done again?
Well, it depends what part of the face or what part of the body, but as a general rule, it's best not to re-operate any sooner than 3 to 6 months after the first surgery. In general, you want to wait until all the changes from the previous surgery have plateaued and before you consider redo surgery. In other words, there aren't any more changes.
Right.
The swelling has gone down and the patient would be then ready for additional surgery.
All right, Dr. Peter Fedor, thank you so much for being with us. And for more great health news and information, you can go to the health page at abcnews.com.